As far as allopathic aspect is concerned, they are very right in mentioning that there is no cure for kidney disease. But then you are missing out at something, and that is there is no cure for kidney disease in allopathy. Even in Ayurveda, it's not very easy to repair the damaged nephrons. When we talk about the nephrons which have lost functionality, I would like to comment that it is the physiological damage more than the anatomical damage in the initial phase that occurs. Slowly and gradually, anatomical damage is also creeping. But still, there are a fair number of nephrons which are anatomically not very much different from the normal nephrons. That is, even to be more precise in allopathic terminology, if we go at the cellular level, we can see that their cell structure is with less amount of cytoplasm while the nucleus is intact. If we can improve the microcirculation of that area and provide certain herbs with their phytochemicals in a proper dosage, that can once again restore the functionality of many of those nephrons, as a result of which the functionality of the kidney improves. Now, even if the functionality of kidney improves by some percentage, say we are not able to improve the kidneys by complete 100%, and that we won't say we are able to do. In majority of the cases, the functionality improves with some percentage. But the good thing is, even if we are able to restore the functionality of kidney by 50%, the creatinine level of the patient stabilizes below 2. That means that the patient can lead the rest of his life with a bit of do's and don'ts that he has to follow as per our guidelines, with the creatinine level hovering around between 1.2 to 1.5 to 1.7. That is, the patient can lead a life with a bit of restrictions, a bit of changed lifestyle without the fear of dialysis. See, when we talk about kidneys, what exactly the kidneys are doing? The kidneys are filtering out the metabolic wastes from our body. If the kidneys are not working in a proper way and we are following a lifestyle due to which the metabolic wastes are too much, it gives an added burden on the kidney. However, if our lifestyle is such and the diet is such that the metabolic wastes are minima, automatically the load which is coming on the kidney, the functioning that is required by the kidney is a bit lesser. So it makes the work of kidneys that much easier, as a result of which it gives a chance to the kidney to improve in a better way. It is just like the case that if a person is sick or ill, along with the medications, we advise that person to take rest. If we give a bit of rest to the person, the chances of improvement of the person are more. While if we make the person overwork when the person is already not well, the chances of his or her recovery are comparatively less. The same goes true with kidney. If we are able to provide with a healthier lifestyle, with a healthier diet style, this reduces the workload of kidneys. For our body, that transplanted kidney is an enemy, and the immune system of our body is already attacking the kidney. So, as a result of that, the allopaths, they give immunosuppressants to a patient of transplanted kidney. When we are providing treatment to a transplanted kidney patient, we also in Ayurveda are to keep in mind that we are not to provide immunomodulator herbs. Those herbs which improve the capability of immune system are not very beneficial for a transplanted kidney patients. So, whereas in a normal kidney patient, we do provide Rasayan Aushadhis, the medications which improve and enhance the capability of our immune system. In a patient with transplanted kidney, we avoid these medications. We don't provide medications which improve the immune system, because if the immune system is potentiated to a greater extent, it will attack on the transplanted kidney and further decrease the lifespan of those transplanted kidneys.
Call now to connect with world's senior most Ayurvedic healer, Dr. Navdeep Sharma.
Modern life is full of stress and worries. The competitive world has given us a challenging life, and many a times we cannot cope up with a fast-paced life, which leads to physical, mental and emotional disorders, which shatter us completely. In the modern world, mental health disorders have become a leading cause of disability globally, exacerbating human health. With the divine blessings of Lord Dhanvantriji, hope lies in Ayurveda. Dr. Navdeep Sharma, a spiritual healer from the city of the Golden Temple. His graduation from Sri Lakshmi Narayan Ayurvedic College, one of the oldest institute in our country, associate with Sri Durgyana Education Foundation. His masters from the University of Madras. His PhD in the role of Ayurvedic herbs in psychological disorders. Listed in the World Book of Records for promoting Ayurveda and developing a chain of Ayurvedic treatment and Panch Karma centers in various parts of the globe.
डॉक्टर नवदीप शर्मा को दुनिया भर में आयुर्वेद का जागरूकता फैलाने के लिए सम्मानित किया गया। लंदन में इंडो यूके लीडरशिप समिट में द वर्ल्ड बुक ऑफ रिकॉर्ड्स ने दिया उत्कृष्ट पुरस्कार।
लंदन में इंडो यूके लीडरशिप समिट का आयोजन, आयुर्वेद को लेकर जागरूकता पर जोर, द वर्ल्ड बुक ऑफ रिकॉर्ड्स ने लोगों को किया सम्मानित।
Commendable Global Recognition Award was received by Dr. Navdeep Sharma and Dr. Monica Sharma on behalf of ND Care Nirogam Private Limited for leading Ayurvedic services at the British Parliament, UK.
ब्रिटेन में बसा भारत का डंका, नवदीप शर्मा और डॉक्टर मोनिका शर्मा को मिला आउटस्टैंडिंग कंट्रीब्यूशन टू आयुर्वेदिक हेल्थ सर्विस पुरस्कार.
Dr. Navdeep Sharma has also been awarded the title of Pranacharya by the Akhil Bharatiya Ayurveda Mahasammellan.
आयुर्वेदिक डॉक्टर नवदीप शर्मा को युवा प्राणाचार्य की उपाधि दी गई. भारतीय आयुर्वेद महासम्मेलन में सम्मानित किया गया. कार्यक्रम में मनोज तिवारी मौजूद रहे.
नवदीप शर्मा को विश्व के सबसे युवा प्राणाचार्य की उपाधि मिली है. अखिल भारतीय आयुर्वेद महासम्मेलन में मनोज तिवारी भी शामिल हुए.
Up next, most trusted Ayurveda-based healthcare brand of the year, and it goes to ND Care Nirogam Private Limited. Dr. Navdeep Sharma, Director, to please join us on stage.
देखिए, अटल बिहारी वाजपेयी जी हमारे लिए बड़े ऑनर्ड हमारे प्राइम मिनिस्टर रहे हैं, बहुत बड़े लीडर रहे हैं और उनका अवार्ड उनके सम्मान में किए गए समागम में अवार्ड मिलना अपने आप में बहुत मायने रखता है.
Regular panelist on various national and international media channels.
आते हैं कोरोना संदेश.
सभी व्यूअर्स को मैं डॉक्टर नवदीप शर्मा नमस्कार करता हूँ. पिछले 21 वर्षों से दुनिया भर में आयुर्वेद के माध्यम से मैं इलाज कर रहा हूँ और आज मैं देख पा रहा हूँ कि पूरा विश्व आयुर्वेद की ओर इम्यूनिटी बढ़ाने के लिए एक उम्मीद से देख रहा है. सदियों से ही हमारे यहाँ राजा महाराजा चांदी के बर्तनों में भोजन का सेवन करते थे अपनी इम्यूनिटी को बढ़ाने के लिए. तो आप सबके घरों में चांदी की पायल, बैंगल, पेंडेंट, कोई भी आभूषण हो जिस पात्र में आप पानी स्टोर करते हैं उसमें वो डाल दीजिए. उस पानी का सेवन करने से आपकी इम्यूनिटी जो है वो बेटर रहेगी. शुंठी, मरीच, पिपली, ये 3 हर्ब जो किचन की शोभा बढ़ाती हैं, इनका इस्तेमाल अधिक कीजिए और भस्त्रिका क्रिया अधिक से अधिक कीजिए. 3 चीजों का इस्तेमाल करने से आप हृष्ट पुष्ट रह सकेंगे और कोरोना नामक महामारी को दूर भगा सकेंगे.
Person who is a doctor in Ayurveda, he is designated to work as a surgeon. The person first has done a course of 4.5 years of BMS in which he is taught the allopathic pharmacology, the pathology, then surgery. These all are subjects in Ayurveda. An Ayurvedic doctor has to study both the things, the Ayurveda as well as the allopathic aspect, looking at the modern demands. Now after that is 1 year compulsory internship, where in colleges like Apollo, BHU, Udupi, Bangalore, there are so many surgical branches running so successfully. Again after this, the doctor who has done BMS, he is required to give a PG entrance test, which is really very tough with so limited seats. And once the doctors who are the best are selected across the country, they have to do a 3 years of PG program, where they are given practical training for all those kinds of surgical procedures which have been allowed to them. I would also like to tell and add that after this there is a 2 years of PhD program for them, which is done by many doctors, and also there is senior residentship, which is the same as allopathic system. So in no way there is any cut short for any Ayurvedic doctor having to do the surgery, and this is something which is really confusing for everyone.
लेकिन ऑटिज्म च इस तरह नहीं है, लेकिन बच्चा काफी हद तक नियर नॉर्मल हो जाता है अगर बच्चे का इलाज सही अंदर शुरू कर लिया जाए.
जी, आज अगर ईडी की बात करते हैं,
देखिए ऑटिस्टिक बच्चों की जब हम बात करते हैं तो जो सबसे कॉमन चीज ऑटिस्टिक बच्चों में देखी जाती है.
Regular coverage in most newspapers around the globe for his exemplary work in the field of Ayurveda.
When I was younger, I was very sensitive. I could feel the pain that people endured. My father once told me, "It's good that I can feel people's pain. It would be even better if I could transform one's pain into soothing relief." These words of my father nourished and nurtured the divinely planted seed in me to become a compassionate healer. And my journey with Ayurveda, the science of life, began. According to Ayurveda, our Panchabhautik body is an amalgam of space, air, fire, water, and earth. And solution to all chronic ailments lies in balancing these body elements. As the origin of Ayurveda goes back to thousands of years, so some part of our ancient historical knowledge is lost. That's why I started my own research and shared it with the world. Ayurveda can give very quick recovery, even quicker than allopathy in most chronic ailments.
The blend of Ayurvedic medicines, Panchkarma, Yoga, diet has helped Dr. Navdeep Sharma create the brand Wrist Pushed and Team Nirogam by treating thousands of patients suffering from chronic illness.
अल्लाह डॉक्टर नवदीप शर्मा की उम्र दराज कर. थैंक यू डॉक्टर नवदीप शर्मा.
So thank you, Dr. Navdeep Sharma.
Dr. Navdeep Sharma from Wrist Pushed. You are the best. Thank you, Dr. Navdeep Sharma.
Dr. Navdeep Sharma, you are the best.
I want to take this opportunity to thank Dr. Sharma for giving Robert a disease-free life.
Thank you, Dr. Navdeep Sharma.
Join Dr. Navdeep Sharma's guided path of healthy living. Call now at +1 888 624 5925.